Thank you all so much for joining us tonight. We have some awesome speakers for you and a really great topic as well. I will go ahead and introduce Dr. Jamie Reynolds and Danielle Offerman, and we'll let them take it away.
Thank you, Katie. Pleasure to be here. We're going to try to give a lot of content tonight and drop about 90 minutes of stuff into 60 minutes of time. Unfortunately, we cut out some of our videos and jokes, but they don't get laughs all the time anyway. So if you've seen me talk before, you know I like to reference a lot of books. A great book by Nassim Nicholas Taleb is Anti-Fragile. And in that, he talks about how we have a definition for fragile in American language, disproportionately more harm by a large event than a small event. We don't really have an antonym to that. What's the opposite, which he proposes is anti-fragile. So if we think of an example, you could think of me. If Danielle were to take the iPad and hit me on the head with it, I'd probably have a little lump on my head, but I'd get over it. But if she hits me with a sledgehammer, then there's no more me. So I am quite disproportionately harmed by a large event versus a small event. And he also opines that the absence of stressors in a particular environment make the likelihood of fragility more likely. So if you think about orthodontics, for example, over the years, we've had about 8,000 people in our space that have been responsible for the treatment of about 300 million plus people in the United States. So we really haven't had any competition. Now we do, but as a result of no competition over time, it's probably made our systems more fragile. We built them around what the doctor wants, and flexible payment terms and flexible scheduling, outdated technology, people that still use headgears. Those are things that all contribute to the fragility and the disruptability of our space. So what he suggests is things that can become anti-fragile, that they thrive and grow when exposed to stressors and volatility. And although me, a single human being, is fragile, the human race, for example, is anti-fragile. It thrives and grows when exposed to stressors and volatility. And so what are the things that we can do that can make us more anti-fragile? And in our opinion, the things in the orthodontic space revolve around marketing, sales, and customer service. And so what we're going to do today is talk specifically about our sales process, which weaves in marketing and customer service. And so when you think about defining marketing, the way that we look at it is marketing is the message that you put out about your business and why it's important. So when you are talking into the universe about why people should be doing business with you, that's marketing. And it revolves from the way that your office smells, the way that your office looks, what technology you have, what clothes the people in your office wear. All those are marketing messages. And also is what the doctor talks about treatment. And so when doctors are explaining treatment and why people should spend money in their office, that's all part of your marketing.
And sales is the process of taking a prospective customer and converting them into a customer. And there's no need for anything to be slippery or deceptive here. We need to remember never to try to sell anything to someone that doesn't need it. With sales throughout OrthoFi, we account for all of our conversion by a method called TRC, Treatment Recommended Conversion. And it's a scoreboard for our marketing message and how effective of a communicator we are and why our message is so important. And you can't get better at something that you're not keeping score of.
And so when you think about your marketing process, the information you're putting out there when you're recommending treatment, sales is simply the process of taking that person and converting them into a customer. And then TRC is the scoreboard for that. And we're going to use some sports analogies today, and it fits in perfectly with that. We're going to show you a process today. And although Danielle is a amazingly high performer, and she wasn't here when we were doing this, we're going to be able to show you how we're not here because we figured this out from the beginning. So this is our conversion percentage in 2014 when we first started with OrthoFi, 35% TRC. And so we started with OrthoFi more out of need than out of us knowing everything and how to do all this. But over the years, we've studied and learned and evolved and changed and tried to become more anti-fragile. And we've evolved. We've also added Danielle with some amazing experience in sales. And so every year, OrthoFi does a top 10 scoreboard for the best 90-day TRC, and you'll see Danielle in there, but also you'll see 4 other of our treatment coordinators, Julie, Courtney, Melissa, and Emily. And we've got 5 doctors in our practice, 4 treatment coordinators, and we have 8 people in the top 8. There are 4 people in the top 8 out of 500 TCs around the country, and we've evolved from being at 35%. So this isn't to say that we knew how to do this all the way along. We've developed a system and a process that works across multiple doctors with multiple people. And if you just follow this process, there's no reason why conversion percentage in your office can't be at this level either.
Now, most people think that sales happens at the point of sale, and they only really communicate about value when they're ready to ask for something. But real value is intentionally created, proactively created through strategy, sequence, and scripting. And it happens throughout the patient's experience. So by the time you're ready to ask for something, they're already nodding their head in agreement with you.
So when we think about going through first the strategy, then the sequence, then the scripting, it all starts with the patient. And I make this disclaimer for all these sales talks we give. So just because we're talking about sales, it doesn't have to be a dirty word. And it certainly doesn't imply that we're going to do anything disingenuous for the patient. In fact, orthodontists need to be the gold standard for treatment for orthodontic patients. Otherwise, we commoditize ourselves and we're just the same as all the direct consumer or all the other companies that we complain about. So we must keep the clinical integrity of orthodontics at the gold standard. The differences, though, contained within that particular patient is also a customer. And results for that customer are a threshold motivator. So they have to be a certain point good enough with clinical results. And then beyond that, the patient doesn't really understand the difference. And so all the rest of the finishing results become altruistic. We need to do them, but our patients and our customers can't understand the difference.
The doctor sees the patient as a patient. We see the patient as a customer, someone that we're providing a service to. So it's important to highlight and identify the services that we're going to provide for that customer, including the end results. And that's by building value throughout the exam process and throughout the clinical experience as well.
So we were curious as to what patients found valuable, and we were thinking about doing a survey, and there really isn't a lot of published data for surveys in orthodontics. So we thought about Net Promoter Score, which a lot of businesses include OrthoFi use, and what we realized is that with the advent of the internet and things like Google reviews and Facebook reviews, a lot of the information about what patients think about it is already out there on the internet. So we went to all these different offices and we looked at their online reviews, and we took their 4- and 5-star reviews, and then we went through over 5,000 of them, and we categorized what the things were most important. So we tried to distill each review down into one word that review was written about. And what we found is the overwhelming word among all of them was the word friendly, almost 2 to 1 relative to the rest of the words. The second word was professional. And what does that mean? And then the rest of the words are sort of some, almost some blend of friendly and professional as we go along. And so when you're thinking about the things that your customer wants, you need to remember friendly, professional, helpful, amazing. Those are all the things that they're are generating 4- and 5-star Google reviews. And so you're going to want to be highlighting those aspects about your office. And so when we think about in sports, they talk about defense winning championships, and that may be true unless you're from Detroit, where we're from, where nothing helps us win championships in sports anymore. But what we're going to suggest is a different paradigm where offense wins the orthodontic patient, and not being offensive, but just understanding what patients are coming and seeking treatment for, and understanding questions that they're likely to ask, understanding what's important to them. And then before you wait till the point of sale, when you're trying to sell them something and they ask questions and then you answer them, which seems very defensive, you're going to work on answering all these questions and creating value for the process along the way. So the way we're suggesting the sort of modern orthodontic consult is to focus on 2 things. One would be proactive value creation, which we talk about at the very beginning. Value can be created proactively.
We can create proactive value from the beginning. In addition, what we also want to do is be proactive when it comes to objection management. We can identify through OrthoFi's research and findings that there are essentially 5 objections that most of us see in our offices in regards to why patients aren't starting. So we suggest that the patient's objections can be largely anticipated and proactively mitigated. That we approach this in a proactive way with the sales and the value creation. So we want a proactive value creation, proactive objection management, and we're calling this the PVC palm approach. But you need both of these things to make it work. You can't really have one without the other. In order to start to overcome some of these objections, you want to start selling unparalleled value. How do you do that? You start that through proactive listening. They sit down, how may I help you? And you stop there and you listen to how you can help them. Throughout the process, you're always setting expectations because you want them to know what the next steps are going to look like. You want to make sure that they don't have any question, because people tend to, when they know what's happening next, understand what's happening next, and there's a limitation of the type of objections they're going to have. You want to be thorough throughout your tour with your technology and also with your team. These things are going to help you sell that unparalleled value. You want to ask calibrated questions. What about this isn't working for you? How can I help you? And then you also want to be sure that you're offering flexible financing as well. You want to make excellent orthodontics affordable for everyone. It's important when you're setting the expectations to also identify we have same-day convenience. And we can start doing this, we start this from the very beginning. Our front desk team will begin to set the expectation for our same-day convenience. If our folks don't know we offer same-day convenience, how can we expect them to be prepared to make a financial decision the day that they come in for the appointment? So that's important that we're setting that expectation. There are typically 5 objections: financial, affordability, possibly schedule. This is the 5 objections that OrthoFi has gathered data on. Another objection may be insurance. Maybe their insurance hasn't kicked in yet. Maybe we're not sure what the benefit's going to be. You don't want anything to slow down the process of starting a patient. Maybe it's possible dental work. It could be an objection, or a second, third, or fourth opinion. We have to keep in mind that everybody is a second opinion. You can be the most amazing orthodontist on the planet, but they are getting more than one opinion. So it's really important to treat everybody like they're a second opinion, and that's the roll out the red carpet treatment.
I think the tendency is when someone tells you that they're a second opinion, then all of a sudden the behavior changes and then you start doing things a little bit differently. When you realize that everyone is or could be a second opinion, whether they tell you or not. I think many of us have been in the circumstance where we make it to the very end of the consult and the parents have told you several times that this is their first opinion and the kid lets it slip that they've been to 3 other places. When you start treating everyone as a second opinion, then it takes the pressure off mentally of treating them any different. And then, every patient, regardless of second opinion or not, should be treated the same. And so when we know the things that patients are valuing, we know the things that are valuable to them, and we know when OrthoFi, when you don't start with a patient, it catalogs the reason why. So we know the 5 top reasons why patients say that they're not starting those objections. And we know that we treat everyone like a second opinion. You can build a process strategically around making sure that you're identifying all of those things before you get to the point of sale. So anytime you are talking about something at the point of sale, if it's the first time they're hearing it, it's impossible not to sound pushy. And if people are telling you that that you feel salesy or feel pushy, you're doing it wrong. And so strategically, we know when people think second opinions, they think financial affordability. A lot of people think aggregate price, and many of you have seen me show this before. So once you get about more than $5,400 in total price, that vertical line there, then conversion percentage, all those bubbles, gets all over the map. It can be higher conversion percentage or a lower conversion percentage, and that becomes regardless of what the price is. In fact, OrthoFi's data shows the lowest priced practices have the lowest conversion percentage. So there's more to work there than just total price in conversion percentage. We also know that the best way to increase conversion percentage, if what you're trying is to focus on same-day starts and the convenience of same-day starts, not focusing on hey patient, I want to do a same-day start because I want to raise my TRC. It's focusing on the things that are in the patient's best interest and convenient to them is why they should want a same-day start. So strategically, as we discussed, you want to set up your processes to proactively create value, manage those objections, and consider affordability and convenience. So which order do you put things in?
What we'll start with is this picture, lovely picture here of our front desk team. When it comes to the front desk team, I know I go on and on about these guys, but the front desk team sets that expectation with that patient from the very beginning. They are talking about taking their information, they're being friendly. That's the most important thing about the interaction with this new patient is the friendliness, right? That's what we're essentially seeing all of those reviews about. But this is our front desk team. They make things happen for our entire team, including TCs. When it comes to the new patient call, we've got a slide here that goes through our basic new patient call. It does everything that we're supposed to do, right? We're gonna be smiley while we're answering the phone. We're staying upbeat. We're using the Jay Geyer method, ask and then wait for a response, not to fill in the blanks for the patients. So throughout all this process, we're gathering really important information. The most important part of the new patient call from a TC's perspective is this very last paragraph about setting that expectation for that new patient start. And it says, when you bring Jimmy into the exam, we'll take some digital pictures for our records, as well as an ultra low dose panoramic x-ray. We'll have you sit down with our amazing treatment coordinator and the doctor. We'll create a customized treatment plan. And if Jimmy is ready to get started with orthodontic treatment, we've already gone ahead and saved time in our schedule as a convenience to you so that Jimmy can get started that same day. Do you have any questions for me? So what did we do here? They set the expectation. Now they know that there'll be some decisions to be made if treatment gets recommended for Jimmy. If the front desk team did not do this, the job in the TC room would be far more difficult than it is. And I imagine that our TCs would come across sounding a bit more salesy or a bit more pushy. But because our front desk team has already set the expectation for same day convenience if treatment is recommended, then when I make my confirmation phone call and I'm saying the same thing, and then I say the same thing again when they come in for the exam, it's essentially the third time that they've heard it. So there will be no deer in the headlight look when I say, did you leave time to get things started today? Because they've already heard it a few times.
And it's also important that your front desk tees up the fact a confirmation call is coming. Many of us don't answer phone numbers that we're not expecting, and many of us don't read or listen to voicemails that we have. So if you remind them that you'll be coming, then they're more anticipating it. It doesn't seem as pushy like, oh, I already called them, why isn't someone else there? And so along the presentation, we have some things to wake you up. So if you hear the little cash register sign, that's a spot in our process where we're creating value and building value and then managing objections along the way. So if you think about from a value creation objective management standpoint, these are the areas for the new patient call.
So when we talk about proactive value creation, we talk about being friendly, introducing ourselves, setting the tone for what they can expect when they interact with our office. Smile, or otherwise they can literally hear your RBF through the phone. Also recognize that, recognize the buying signals. This person on the phone will do business with you if you do X. Example, do you take my insurance? Which means I'm interested in orthodontic treatment. My budget's important to me, and I'm curious what impact this insurance will have at making my orthodontic treatment affordable. If you say no, that person is lost and gone forever and never gets the choice to pick you based on your value other than participation in insurance. Are there things in your life that you are willing to pay more for because you like it better or you want it more, especially for your children? So you need to get them into the office. Offer and schedule an appointment. Very difficult for anyone to judge the value you deliver without setting foot inside your office and meeting your team. Always compliment the doctor, highlight about your doctor, about your office, about your team. Get your patients excited about coming into the office and who they're about to meet. When we also start talking about proactive objection management, it's really important to overcome as many objections ahead of time as you can. So by setting the expectations through the confirmation call will clear a path to what we're looking to do with the same day convenience. So our confirmation call is important in setting the expectations. It's important also to have those forms filled out and why they should be filling out those forms. And again, throughout that, you want to always mention the same day start. I always want to ask them as well if they have any questions. It's important to understand their perspective and where they're coming from as well when you have them on the phone.
And all your questions along the way should focus on being open-ended. And so try to avoid the yes, no questions. And although we know what most people will be thinking from an objection management and value creation standpoint, we don't know what everyone's thinking. And the only way we'll find out is by asking, and asking as many times as possible. So at the front desk, if they are noticing some things that the patients have questions about that don't fit your normal workflow, make sure you note that in the chart. The next thing that we do is we send them something in the mail. The reason why we do that is not because, for any other reason than we want to be different than our competition. And so if this package could speak 2 words, the words it would say is open me. And so you don't want to, it's very irritating for people to have redundant stuff. I think we've all been to the doctor's office and they hand you the clipboard and they give you 3 forms and all 3 forms ask you 50% of the same stuff, and so that's very irritating. It's also irritating to spend 10 minutes giving people your address information, having nothing show up in the mail at a time. And then when you do show up, you have forms that have to be filled out that don't have the address information that they gave you on the phone. So make sure that if you are asking that information, 1, you're pre-populating it in your forms, either written or if you use OrthoFi, putting it in there. And second, it'd be nice to send them something in the mail. So what goes in our little mailer? We have a folder in there. There's several pieces of paper in there. The most important of which is this one that says start here. And number 1, we want to complete the health history forms because we know that that's important. Number 1 reason being insurance, which remember is the 3rd objection, which we'll get to in a minute. And we also want to tell them, hey, prepare to get started. We know you're busy, your time is valuable. For your convenience, orthodontic treatment is recommended for you. You always reserve time the same day as your appointment. And so that's just another time you're tuning into their radio station, reminding them that we've saved time for them because it's convenient for you. We know that you're busy. The second thing is you want to say, hey, orthodontic treatment is not free. It costs money. And for many of you, it might cost more money than you're willing to pay for up front. A lot of people run from that discussion. And it's pretty simple. They all know it. When twins get surveyed, parents of twins get surveyed when they're born, the first thing they're worried about is paying for a wedding at the same time. And the second thing they're worried about is paying for braces at the same time. So people know that what we do costs money and that it's something that is challenging to afford. So we tell them, hey, we pride ourselves in not letting affordability stand in the way of life-changing transformations. So please consider a down payment and monthly payment that works for your budget and we'll do the rest. So it's another spot along the way where we're creating value.
This book, World Class Smiles, is probably one of the best tools that I have in my TC room, especially when our patients are going for a second or a third opinion. This is a book that gets put inside that bright blue shiny package that everyone's super excited to open before they even walk into our office. So we're certainly setting a tone, and we're also helping to educate our patients. This book isn't necessarily directed for people to come back directly to us. It's more of an overall view of orthodontics on a whole by creating some authority. I love giving our patients this book, especially when they're headed for that second, third, or fourth opinion. I explain that it's an easy to read, informative orthodontic guide. It provides an easy to understand overview of the different types of dental providers and the 11 things parents should consider when choosing an orthodontist. Why do I give them this book? Because I want the patient to understand their different choices when selecting a professional and why it matters which one they choose. I want parents to read the 11 things parents should consider when choosing the orthodontist because 1, I know that our doctor is a specialist. 2, I understand the benefits for early child evaluations. Number 3, we have an amazing reputation. We treat adults. Number 4 and 5, we guarantee our results. 6, Our fee is inclusive, all inclusive. Number 7, we have the greatest and latest technology. I know that we offer affordable payment options and our office runs efficiently, and we have a fun office. I say these things because I know that I've incorporated these 11 things in my office tour, in the consult, in the treatment presentation fee. I've covered all of these, so I feel very strongly giving this book to somebody, earmarking page 71, and letting them take that with them to their next consultation.
So this is another place along the way. It's just building value. We all know being the authority in your marketplace is important, and being viewed in that is important. And the word author is contained within the word authority. Nothing is in this book that anyone listening couldn't write. It's just a matter of going through the process of doing it. And it's another thing that your team can use along the way to build the authority of the office. Now, this is a great tool that OrthoFi has developed for us. And, I think the idea of filling out the forms before you come in is great. And for those of us who have been using it for a while, it was on the computer and they clicked through on the email. And it was a really big inflection point when they optimized these for the phones, because the amount of people that fill these out skyrocketed. And yes, it's nice to have the HIPAA and privacy policy signed ahead of time. Yes, it's nice to have their information they can fill in. And remember, you want to pre-populate some of the stuff that you've asked them on the phone. And it's nice to know some of the health history stuff that we as doctors care about. But the real reason these are great is because you can get their insurance information ahead of time. And we know the number 3 objection for patients is that they don't know what their insurance is going to pay, so they're going to pause or get treatment later. And it's very difficult to get insurance information in a timely manner when people walk in the door for the very first time and start filling out the forms. OrthoFi has done an amazing job writing patient or insurance algorithms and machine learning algorithms. So about half of the checks that they can do automatically within the click of a button, a few seconds. But still half the calls, it's someone at OrthoFi getting on the phone and, sitting on hold dealing with pain in the butt insurance companies, just like many of us have done for years and years. So the ability to get this ahead of time is super critical in crossing that barrier. It's very valuable to the patient because, for them to be able to come into the office, their time is valuable. We can give them a comprehensive exam, treatment plan, and tell them exactly how much their out-of-pocket cost will be in that day is a very value-added step. So communicating that ahead of time is super important. Now, OrthoFi runs a bunch of stats, and so they know that if you fill out the form, this is a little confusing, so bear with me. If you fill out the form, 71% of the time, that's the lowest amount. So if somebody calls in, gets their OrthoFi stuff set up, and then OrthoFi will send an automated email out for them to click on so they can fill out their forms. So at the baseline level, 71% of those gets filled out, which is pretty high. 3/4 of the work is done before they walk in. The same day start percentage when you measure that in those patients is 7%. Now, the highest is 82%. So just over 10% more is the highest in OrthoFi for what percentage fills out forms before they come in the office. And the interesting thing is that same day start measurement for that group is 74%, 70% more than just 10% less in form fill. So what's the difference? A lot of us are looking for the infusion softs and the automations and the survey monkeys that can go out and do all of our work for us. Well, what's happening here is that the people, if you are playing offense, if you know that people are 70% are going to fill out your forms, they're reaching out and proactively engaging with those people to remind them to fill out the forms, and they're setting expectations using a confirmation call, setting that expectation that that same day start is possible. And those people that are playing offense, doing the extra work, trying to win that extra business, are able to increase the amount of same day starts that happen in their practice by, up to 75%, which is an amazing, amazing, amazing number. And so it just shows you the power of reaching out and playing offense.
A big part of setting the expectation is making sure that we're doing confirmation calls. Now, I will give you some suggestions on some scripting and some verbiage in regards to that confirmation call. I can certainly help and send that specific scripting to you if you'd like to. But it's important that, I mean, if your TC isn't making the confirmation call, we're not setting the right expectation. So it's important that when we run through these confirmation calls that we're talking about the value of the forms or acknowledging the fact that they've already filled them out. We're talking about legal guardians and making sure that you're bringing all the decision makers. You want to talk up your doctor as well as the office. We want to talk about the financials. I don't think that should be something that we're not talking about, because you want them to know that you're going to make this as affordable for them as you can. You have flexible, intelligent financing, and you can make this very affordable. You want them to be able to also, on that phone call, you want to talk about considering a down payment and monthly payments, because what you're looking for them is to be prepared to make a decision while they're in your office. When it comes to the confirmation call, I would suggest doing this one of two ways. You're either going to give them a call and get on the phone with them, or if you don't get them on the phone, I would suggest sending a video message. A video message can sound just like your confirmation call. And it can have all of the same information in it. And the reason that I like to send video messages rather than an email or a text or or leaving a message on the phone is because most people don't listen to their voicemails. Most people don't often open their emails in a timely way, but people will open up a video message from somebody that they're not sure who pops up on their screen. So I think that the video messages are a big part of it. So the confirmation call can go a little bit like this.
So one of the things that we took out of the presentation, because we weren't sure how the video would come through, is an actual example of a video confirmation call. But what these are the things that you want to make sure you include in your confirmation call. Now, Danielle, you do a bunch of confirmation calls every single day.
Yeah,
right?
At least 10.
So do you think on the fly that you could pretend that these guys are on a confirmation call?
I think I can do that.
Okay.
Absolutely. So let's say you have not answered my phone call. I'm going to hang up and I'm going to send a video to you. It's about 1 minute and 10 seconds in total. And I'll very friendly, very smiley. My name is Danielle and I'm a treatment coordinator here with Splain and Reynolds Orthodontics. I understand we have the pleasure of seeing you and Sarah tomorrow morning starting at 8 o'clock in our Novi location. I just wanted to shoot you this quick video message, introducing myself, but also setting some expectations for tomorrow's exam, where we will do an ultra low-dose 3D x-ray. We'll take some digital pictures. I'm going to share that information with the doctor, and then the doctor's going to let us know what the next steps look like. So if the doctor recommends treatment for Sarah, we'll go through all the details of the treatment recommendation. We'll talk about the financial aspect of it as well, and how I can make that affordable and comfortable for you. And if all of that sounds good, we've actually already gone ahead and we've left time to get Sarah started tomorrow. So if the treatment plan and the financial aspect of this is something that works for you, we can actually get Sarah's braces on tomorrow while you're here, because we value your time.
So that's basically an example of how a confirmation call. Thanks.
I'm not done with my confirmation
Okay,
call.
sorry.
Hold on. Thank you very much. You also want to make sure, if they've filled out their forms through OrthoFi, acknowledge that. People don't want to think that their time is being wasted. So if they've already filled out their forms, thank you so much for taking the time to fill out your forms. In fact, we've already gone ahead and verified your insurance benefit. Now, do me a favor. If you are unable to make tomorrow's appointment, give me a call, and we can find a time that better works for you and Sarah to come in. Otherwise, we're looking super forward to meeting both you and Sarah tomorrow morning at 8 o'clock in our Novi location.
Are we done?
I'm done now. Thank
Okay,
you.
good. Okay.
Yeah.
Thank you. So anyway, that's the confirmation call. So, I would make the argument that doesn't sound pushy if you listen to it. It sounds friendly. It's setting expectations. It's telling them, that we respect their time and convenience, and just letting them know what to expect. Because remember, when they get in the office, they're going to be overwhelmed. People don't pay attention to much anymore. And so along the process, you want to be redundant with these things, because not everyone is going to, read and listen to every single thing that you have to say. Most people are going to not listen or read to much of anything at all. Mm-hmm. And so if you can be tuning into their radio station that they're playing inside of their head, along the way, then by the time it comes for them to make decisions, nothing is surprising, and surprising equals pushy.
We have the great fortune of, with our online forms, finding out what's important to our patients. So as a salesperson that I am, and I've been in automotive sales prior to being here with Reynolds, I was in automotive sales for 10 years. And had I had this type of insight with my customers, then I know that I would have had more sales. I think it's interesting that we are able to see the things that interest our patient the most, and then we're able to frame our tour and our presentation and our scripting around the things that matter most to your patients. Is it the length of treatment that's important? Is it the comfort during treatment? Is it the latest and greatest technology? Is it the having a low monthly payment? These are things that we know before we even sit down with our patients, which is so valuable and allows you to frame up your presentation and not sound pushy.
And does this change the outcome in the clinic? It does not. The doctor is going to do the same stuff in the clinic regardless of exactly what gets presented in the treatment process. But what it does is it validates the things that are important to the patient. And so that's the key thing, so that they can feel heard and they can feel like what's important to them is important to us. And so this is just a graphical way that we call it the cheat sheet, can show you to make it easy to see what's the most important to that patient. What we've set up as we've been going along in the sequence, these are the things that happen before you get to the office. When you get into the office, someone with a smiling face greets you. And then they begin the process of our office tour, which is another thing we'll have Danielle walk you through.
The office tour is very important if you want to proactively build value, if you want to proactively overcome obstacles. Now, envision yourself walking through the doors of Splain and Reynolds Orthodontics. I will be there greeting you with a big smiling face. You're new to our office, so I introduce myself, and then at that moment, I set the expectation. My name is Danielle. I'm a treatment coordinator here in the office. Thank you so much for coming in today. We are going to take a low-dose x-ray and some digital pictures, a lot like my confirmation phone call. We'll share them with the doctor and see what our next steps look like. But before we get started, I know that you're new to our office, and I'd love for you to take a look around so that you're as comfortable here as I am. May I do that? May I take you around the office? And absolutely, there's not one person who will tell me no. So then we'll walk by, we'll walk right up to our sign-in station, type your name in, your cute face is going to appear right here. When you start to come see us on a more regular basis, you'll have a seat. Mom and Dad will probably have a seat in the massage chairs, or maybe at the workstation or the iPad bar. Or and then you'll sit back here in the clinic. Now, we don't have any doors on our clinic because we invite everybody back there. We do some pretty amazing things, but let's go back there and see what we're doing. So we go back into the clinic. I point out the short waiting bench, and I say things like, it's intentionally short because nobody waits very long to see one of our amazing technicians. And in fact, Mom, at every scheduled office visit, you're going to see a doctor. Why do I say that? Because if I'm being compared to a Smile Direct Club, and I know they're not seeing a doctor at every visit, or frankly at all, I know that that sounds really good to parents, right? Now, I didn't say Smile Direct Club, doesn't have a doctor. I simply said that at every scheduled office visit, you always see one of our amazing technicians. Every one of our technicians in the clinic itself has their head on a swivel. They know that when we're coming through with a patient, they're turning around, they're friendly, they're kind, the doctor waves, everybody waves. But this is where we build all of our big, beautiful, amazing smiles. Get them comfortable there, let them envision themselves there, show them the brushing station, show them the on-site lab, tell them why it's so valuable to have an on-site lab. If you don't have an on-site lab, tell them why it's so valuable to have an off-site lab. But my point is, build the value in the things that you do the best. We walk back to our technology. This is our ultra low dose 3D x-ray machine. I'll give a little history of the building. It used to be an old bank. And, this was the drive-through area. Now it's a low dose x-ray machine. So we always stop there. We explain the benefits of this ultra low dose 3D x-ray. And we'll go into the pictures, and then we'll end up in the office. So effectively, we've value pointed our technology, our team, and our doctors, we've started the exam process by stopping and having the x-ray made, and then we finish in my office with the pictures. It's a nice seamless process all the way through, but don't ever estimate the value of an office tour.
And so, you know, a lot of times when we talk about these things, doing an office tour and whatnot, a lot of the first objections that we get about changing your process is that I don't have time to do that. And so, you know, one of the things you can think about is that the reason why OrthoFi has built a lot of these features in along the way, from insurance processing to asking the customer what it is that's important to them, is that's a really big shortcut for your process. So then as a treatment coordinator, as an office, you have to spend a lot less time digging into those details because they're served up for you. Especially if you're making that confirmation call, you're getting 80% of your patients filling all that information out ahead of time, which allows you to be prepared, saves you a lot of time in the process. And so when we think about when we get into the exam, there's basically 4 outcomes that come out of an exam.
The first outcome will be the patient's not ready for treatment, the doctor's not ready for treatment. This is a huge opportunity to build value, to get them to come back, to talk about growth and development, maintaining, keeping an eye on growth and development throughout the process. So regardless if we have a patient that's not ready or is ready, we're treating them the same way, but what we're doing now is creating so much value that they want to come back again when the doctor wants to see them. The next will be next option for a possible outcome with that. The doctor says, nope, the patient's not ready, but the patient is so excited about treatment. Maybe there's some social concerns, and those are things your TC needs to uncover and deliver to your doctor. But you want to make sure that the patient understands why we're not recommending treatment yet, why we don't want to put braces on too soon because we don't want them in for long, and that we're looking for what's in their best interest.
And so in this process here, doctors, this is where it's really important for you to create some value in the process and proactively create value, manage objections. So number one, especially if you're a practice that still has a fair amount of people referring to you and you're not recommending treatment, you want to make sure you build the value that you have, the doctor that referred them has not wasted the patient's time by coming in. So you need to, make sure you're thanking the doctor. Make sure you thank Dr. Jones because it's great that he sent him over here for you. Because even though we're not ready for treatment, many times we can uncover things that could be really important that we might recommend treatment. The other thing it gives us is a great barometer for next time you come in. Now we have multiple time points and we can understand your growth better. So it's really important to validate those doctors, and over time they will appreciate that. The second thing that you want to do, doctors, is set expectation for what's going to happen next time. And it's going to be one of 2 things. One, they're in some growth guidance or growth and development program where you're not expecting them to be ready. So let them know you're not expecting them to be ready next time. I'm going to see you back in 8 months or 12 months or whatever the increment might be, and say, I'm not expecting Johnny to be ready for treatment next time, but it's important that we keep an eye on things and make sure nothing unexpected happens along the way. If you are expecting them to be ready for the next time and you're scheduling them with some time with the treatment coordinator, go ahead and let them know that I'm expecting Johnny to be ready for treatment next time. And, we know you're busy, as a convenience for you. We're going to go ahead and save some time that day so that you can get started next time. And so by doing those things over time, you'll notice if you're measuring your conversion percentage that your recommended treatment to a new patient typically converts less than recommended treatment to a recall patient. And the reason that happens is that A, they're coming back multiple times, and B, you've had, if you're doing your job right, you've had time to set the expectations and proactively create value so that when they come back in, nothing's unexpected. They're coming in expecting to start that day.
So that's a slam dunk, right? The doctor's ready, the patient's ready. As long as your TC has done their job, then we can consider this a same day start. How about the doctor? Yes. The patient? No. This becomes the most difficult of our 4 options here. And this is why it's so important to not wait until the point of sale to build value. You want to make sure and assume everybody is always ready to start treatment and you're building value according. If you assume or look in the, you don't think the patient's going to be ready and you're not giving it your 100%, then the chances of the doctor recommending treatment are there. And then if you need to start selling treatment, you're doing it after you realize there's a treatment recommendation. What can come across is really pushy and too salesy. So just do your best to build value throughout the experience so that that patient no can become a yes, because you've overcome most of the obstacles that we can see when a patient says no.
So we could teach a whole day course on this book. I think it's the best business and one of the better life books I've ever read. Never Split the Difference by Chris Voss. So add at the top of your reading list if you're a book reader. One quote in there that I think is super important is, if you approach negotiation thinking that the other guy thinks like you, you're wrong. That's not empathy, that's projection. So a lot of us are, thinking, well, I feel this way, so, I might not pay that much for a lifetime retainer or retainer insurance as a TC. But that's not your job to think what you would do. Your job is to create the value for that and let the patient choose. Otherwise, you're projecting your feelings on them. And so, when we look at some of the financial data that's been created by OrthoFi over the years, and, it's several $1 billion worth of patients through the system. When you're thinking about strategically, we know that the assumption would be that if you increase the down payment, so what this is the down payment on the left, monthly payment on the bottom, and then those little bubbles are credit scores. So as you increase the down payment, the higher credit scores are more likely to make those down payments. So if you go to the right, you see the bigger bubbles making a higher down payment. And so you would expect that, and that actually is true. But the difference is that all credit scores, even the best, are under 1,100 down payment, what they choose when they have open choice, and almost everyone else is under 1,000. So if you're making a $1,500 or $2,000 down payment, your minimum, no one would choose that if you let them. The other interesting thing, as we've talked about a lot before, is the monthly payments between credit scores. So they only vary by about $20. So I think the assumption that people with higher credit would be willing to pay a much higher monthly payment, and it's just false. If you also look at, it's around $200 is the monthly payment they would choose. And so that is a valuable thing, to be flexible and allow affordable financing in your practice. The second misconception is that people won't pay interest. We know 12 to 15%, depending on where you are in the country, pick interest-bearing accounts. And the average price for OrthoFi payments for OrthoFi treatment fees is a little over $5,000. But with patients who pick interest, they're paying almost $500 more. But for the ability to pay $500 down and $150 a month. So people will pay you more, and they'll pay you interest for the ability to be able to afford it if you're doing a good job creating the value for them, so they want to pay you more. And we've talked about this quite a bit before. So what you want to do, if you're being smart, is all these people here, you have your typical plans in the circle, and then in the green, you have all the people who have picked a down payment and a monthly payment that is favorable financially to the office. So they're paying you more at the beginning than what you're spending. And so if you look, someone chose $4,500 down and $50 a month, and on the other side, somebody put $250 down and $730 a month, and everywhere in between. So we don't know what it's going to choose. And open choice is extraordinarily powerful. So instead of taking those dollars and going out and spending it, what you do is you create leverage, and then you apply those payments to the people over here in the red box who put down payments that are less favorable for the office. But saving the green to apply to the red is what creates leverage, and it allows your practice to grow. Another interesting thing that we've discovered is that if you look at these vertical lines, these are delinquency. One side percentage of accounts, and one side percentage of accounts of AR dollars, percentage of dollars. So if you look at the tier 1 credit, the green bar at the bottom are people that have a payment method on file. And the blue ones are the ones that don't have a payment method on file, and they're 10 times more likely to become delinquent, even in the best credit tier, if you don't have a payment method on file. So if you're talking to them about it, a lot of people say, well, we can't do that in my area, which is false. You're just not doing a good enough job building good reasons why. So instead of saying, well, to start treatment, you have to put a payment method on file, you say, for your convenience, we'll have a payment method on file. And plus, it's kind of the set it and forget it technique. So you don't have to worry about it. So this is another opportunity for you to build value. And you also, in order to keep the lights on, you need to be paid. And so if you know that you're 10 times more likely to become delinquent if you don't have a payment method on file, it's a good idea to get a payment method on file. And so we're going to spend the last 15 minutes or so sort of walking through our consult and the way that we're doing it. There's a lot of talk about doctorless consults, and we do our consult a little bit different than we used to. We're not advocating doctorless consults. For those of you that have seen me speak before, I like to work Michigan football into all of my talks, and this is going to be no exception. And so if we're making a football reference, this is Bo Schembechler, an old Michigan football coach, when they talk about 3 yards in a cloud of dust. So the way that offenses, if we're playing offense here in football, used to work is that the coach would call the play in, and the quarterback, the person who's in charge of running the offense, would do exactly what the coach said, and they would run exactly that play every time. And sometimes, regardless of what the defense, the people on the other side trying to stop them, were showing them. So they might do a run play, even though the quarterback would know that a run play wasn't going to be successful because of the defense that was up. And so, as football offenses have evolved, if you watch college football now, most offenses that are the highest scoring offenses, they do something called an RPO, a run pass option. So the coach will call the play, but now the quarterback has a better understanding of the offense and has more empowerment behind what they're doing. So then what they do is they come to the line, and the quarterback there is number 8. So he'll get the ball, and then he can either run it himself, he can hand it to number 21 over on the right, who can also run it, or he can decide to pass it. And that's called a run pass option. So you could either run it himself, give it to the running back who can run it, or throw it. What that does is it makes it a much more effective offense, and it empowers the quarterback, unlike they used to do before. The offense in football has evolved. And so what I would suggest is that the consultation process in orthodontics is also evolving. What I would not suggest is that it doesn't involve the doctor, but what I would suggest is that it involves the TC taking a more proactive, educated, skilled approach to work as part of the team to help read the defense better so that you can make sure the most effective play is called. Danielle, why don't you walk them through, you've gotten done, you're about ready to leave the TC room, and then how does it go from there?
Wonderful. So when we're in the exam with the patient, I have digital pictures. We're going through the digital pictures and softly talking about the reasons why we might recommend treatment. Not so specific to that patient, but reasons why we want to either, correct a bite or idealize alignment. We want to educate our patients as to why treatment's important, not just aesthetics, but also for the longevity of a really healthy smile for a while. So I'll typically ask, is there anything about your smile you don't love? They'll let me know what their concerns are. Essentially, I've identified the bullseye for the doctor. So without the doctor necessarily being involved in that initial part of the exam process, I can now go talk to the doctor about the concerns of the patient. This way, we're addressing focus of what is the most concern to the patient. Instead of dancing around why we're going to do orthodontics on a whole, we want to address their concerns. Once you start to talk to somebody directly about their concerns, because you're listening to them and you're proactively listening to them, they're more willing to listen to you. So I'll leave the room, I'll excuse myself. We do a lot of transfer of authority in our office. I'm going to excuse myself for just a moment. I'm going to talk with the doctor. The doctor's going to take a look at this information. He's going to let me know what the next steps are going to look like. I'll talk with the doctor. Doctor, this is what we're looking at. She's not crazy about her upper right one. We did talk about her being in crossbite. We did talk about the possibility of how possibly an RPE, it can help as we start to make some space for these teeth to grow in. So a lot of the time we're spent educating the patient. So the doctor now knows that our patient knows his concerns, knows if the patient, because I've asked, if doctor recommends treatment, did you leave time to stay today? So I've overcome that objection, because if they tell me yes, perfect, hey doc, we're ready to get going if you are. If not, listen, we're going for a couple more opinions, telling the doctor. So the doctor can give the best treatment recommendation for each patient individually.
When she leaves the room and she comes to meet with us, historically what we've done is give her the treatment plan so they can enter the findings in, and then we go in and present the treatment plan ourselves. And then then we say, does anyone have any questions? And then everyone in the room is thinking, how much does it cost? But they don't ask it, and then we leave. Or if they do ask it, then we say, oh, well, Danielle's going to talk to you about how much it costs, which seems very sketchy. So what we've done is that in most instances, we take a full set of photos and a iCat FLX on every single patient. In most instances, I feel comfortable doing the full diagnosis and treatment plan for the patient based on evaluating that 3D X-ray and evaluating their high quality digital photos. If I do not, which there are still cases where I do not, then I will go in, do my physical exam on the patient, and then make my diagnosis and treatment plan from there, and do it sort of the old way. Most of the time, I feel comfortable making that diagnosis and treatment plan. And so in no way am I suggesting that anything other than the doctor's opinion of what should be the treatment should be what's recommended. But what I am suggesting is that the way that it all kind of shakes out from there, as far as how the patient gets towards the start, does matter. What I'm also suggesting is that doctors, we talk too much, and we know too much, and it's very easy to get us to jump straight into a rabbit hole that confuses the hell out of everyone. And so what I'm suggesting is that we're mostly in the way in the sales process. I'm also suggesting that if we're doing our job hiring people, your treatment coordinator is very smart, and most of the time after they've worked for you for a minute, they know what you're going to do anyway. And what I'm also suggesting is that the assumption that the patient requires the backside of your pants to be inside of the treatment consultation room before they choose to do business with you is false on a large number of occasions. Many of those patients can choose to do that without meeting you in that sequence. I'm also not suggesting the patient doesn't meet the doctor. So the doctor should meet the patient at some point along the way. Sometimes at the chair when you're putting the braces on or doing the scans, sometimes in the room before they can decide, and sometimes at the end, before they go in pending. So basically, those are the three different outcomes.
So I'll come back into the room after talking with the doctor. Great news, another transfer of authority. We've talked, the doctors talked in regards to the treatment plan, and this is, what our treatment is going to look like. We're going to do some upper and lower braces, some bite correcting elastics. We're going to be in treatment approximately 18 months in total. This is what we're looking to correct. We're going to broaden, align, whatever the case may be. We're identifying that, right? Identifying their concerns. Perfect. And the next question I always get is, what is the cost of that going to be? So now I have an ability to go right into the financial presentation and how flexible and affordable I can be. So in a lot of cases, we're getting the paperwork out of the way before the doctor even walks into the room. And what we've noticed is that people are very willing to get things started without the doctor necessarily having to be in the room. With that said, there have been times where I'll get, oh, am I going to meet the doctor? Absolutely, you're going to meet the doctor, and he'll be right in. And then we call for him and he comes in. But so much of this can be done without the doctor walking into the room. They can meet the patient in the clinic at the chair side. If the patient goes into a pending status, we want to be sure that the doctor is meeting the patient before they walk out the door.
And from a doctor perspective, I'm spending so much less time in the treatment consultation room. I had several today where I walked in the room and I said, "Hey, I know Danielle's, or today I was working with Melissa. Melissa's been filling you in on everything. What kind of questions can I answer for you?" Very open-ended question. And 9 times out of 10, they say, "Duh, she was great. I don't have any questions. She knows her stuff," which is very validating to the skill of your team. And oh, by the way, orthodontics is a very delegation heavy business. So from their first impression of your team is very impressed. That I think sets you up for success later on down the road. The second thing that's really nice is that the financial stuff is out of the way, so that when I do say, "Do you have any questions?" they don't really have any questions. They know everything that is about it. And if they ask financial questions, it allows me to respond. If somebody's $1,000 cheaper, then I can say, "Well, I could do it. Hey, I can get it from Mr. Jones for $1,000 less." I say, "I could do it $1,000 cheaper as well." And cheaper is a very powerful word. But I wouldn't have be able to afford paying really great people like Melissa or Danielle over here. Wouldn't be able to buy the technology that has probably created the reputation that brought you here in the first place. And I wouldn't be able to treat my family with the way that I would want to. So I wouldn't recommend doing that for you. If cheap is important, and then there are plenty of places besides here, and almost none of those people go elsewhere. So it changes the way that the consultation goes, and gets all of the objections out of the way, especially if you've been doing a good job creating value and managing objections along the way. And it makes the process much more seamless. And we don't have many that go into pending. Danielle, we talked about her conversion percentage before, 90 some percent. And of her conversion percentage, 90 some percent of those are same day starts. So a lot of times also the TCs say, "Well, how do I find time to do all of these other things?" Well, doing a same day start so you don't have to follow up with them forever is the best way to create extra time for you. So reorganizing the consult, just putting the doctor into a different spot, making it more of an evolution like the college football offense is the way that we're doing consults today with great success. So ultimately it comes down to presentation of the fee. And many of you on the webinar use OrthoFi and have access to the slider. Some of you don't. So I've asked Danielle to put a few scenarios in play, and she's going to walk you through exactly the way that she'll present a fee.
So the doctor has recommended treatment. The way that we present fees in our office is an all-inclusive fee. We want to be sure that our patients understand that their orthodontic journey is all-inclusive. So we'll present the fee in total. Our treatment fee, it's our retainer assurance program, and it's our hygiene kit, as well as our whitening as well. And you're looking at a treatment investment of $76.60. Now, this particular patient has a fantastic orthodontic benefit of $17.50. So as you're presenting this fee is inclusive of everything you're going to need to have a successful orthodontic journey in our office. Now, you have an amazing insurance benefit of $1,750. And if you decide to pay for this in full today, you get to save an additional 3%. And then I say nothing. So I'm able to slide that slider all the way over to the right-hand side. I think as TCs, we need to understand the importance of our role in the office, our importance of the production numbers as well. And if you're a TC that slides your down payment all the way down to the minimum down payment, because you're concerned or you're projecting that they may not be able to afford treatment in your office, you're really putting yourself at a disadvantage, and you're underestimating your patient's ability to pay for something in full based on what you think that you know. So I always slide my slider over onto the right-hand side so they can see the benefits of paying in full, the courtesy that we can give them for paying in full as well. From there, if that's not ideal for them, we offer very flexible options. Typically, I'll go right down to $2,500. Why? Because most HSAs or FSAs already have that money in there. Most people don't realize they can use their orthodontic benefits for their HSA for orthodontic benefits. Sometimes I'll even offer, if you've gone to $2,500 this year, what I can do is set up a lump sum payment for next year as well. So you won't have any payments in between. I'll take $2,500 now, and then we'll set them up on a deferment plan until, call it the end of January, the end of January of the following year, and get the other payment in full. That makes sense to a lot of people because they get to take their entire HSA benefit. Now, maybe this $2,500 isn't ideal for them, but I'd still like to try to gather as much same day cash as I possibly can. So then I'll go down to $1,500. $1,500 is a reasonable down payment in most cases. From here, we always offer 0% financing for the treatment time as well. From here, we've got a patient that can't afford the $1,500. We become far more flexible because that's what we said. We're going to be flexible and affordable. So the minimum down payment can be $500. What if your patient doesn't have $500? Then think ahead of the game. Can take a $250 down payment today, set up another $250 down payment 2 weeks from now. It's a little layaway for your braces, and schedule that appointment to come in. But don't lose the opportunity to gain this business because you have a down payment that they can't afford today. Get the paperwork out of the way, sign the paperwork, take a form of payment for what you guys have agreed to, set up your next payment arrangement as well, and get that patient started.
And there's a bunch of great features in the software. The wizard we find to be super effective, and we don't really have time to dive into all of that today, but there's a lot of great features built in. The best way to manage your pending patients is to create all these things ahead of time, so that they don't become pending, their same day starts. But even the best of us will have pending management. You need to follow up. We hear sometimes people complain about OrthoFi being expensive and whatnot, and I think this is an amazing stat. So there's a lot of people who have OrthoFi that don't use the pending management tool for whatever reason. And so they just physically don't ever use it. And OrthoFi can tell whether you're using it or not. And if you just use it, they don't say if you're using it exactly as it should be used or not, but just using it, people see 18% higher conversion rates than people that don't use it. And so that is such an amazing number in conversion just by using the tool as it's designed. So make sure all of you that are on OrthoFi are reaching out to your OSMs and your local people and have them come in and watch your process to see, are you using the tool effectively? It's such an incredibly powerful tool, but you have to use it the right way to get the most out of it. And so to finish, Simon Sinek has a great book called The Infinite Game, and he talks about the infinite game and the finite game. And the finite game, as he defines it, is played for the purposes of winning, has rules, recognizes boundaries, announced winners and losers. It's sort of like football. Whereas an infinite game lives on forever, success survives for generations. And so orthodontics, although we made plenty of sports references here, is not like the game of football. It's much more of an infinite game. I know many of us hope that our practices survive for generations, and the field of orthodontics survives for generations. And so you need to build your processes and systems in your office to be built more on the finite game or the infinite game than the finite game. If you're making a treatment recommendation for that patient that's in the chair at that moment, because you're worried about that dollar, that's the finite game. If you're treating a second opinion like a second opinion because you're nervous about their business, that's the finite game. You should be building your processes, your people, your information, concerned about the patients who will come in the office 1 week, 6 months, 1 year, 5 years, 10 years from now, and be concerned about, are you going to be deserving of their business? Is your business going to be valuable to them? And should they choose to do business with you? And if you find yourself thinking more about the infinite game, you'll realize a lot more short-term gain in the near term, because thinking about things value over the long term communicates more properly to the patient, and you'll find that they're much more willing to do business with you in the short term. One of the things, and because of that, it's really necessary to build that sales and marketing organization that's built on the foundations of treating everyone like family, never recommending treatment to anyone that you wouldn't do if it was your own children. And one of the amazing things about OrthoFi, I think that goes underappreciated, is that they don't really collect your dollars because they want to be a dollar collection company. They don't really help your insurance, especially because they want to be an insurance company. They do those things because those things are all retrospective activities. They help with patients who have already started. OrthoFi is completely gold aligned with the orthodontist in that they want starts just as much as the orthodontist wants starts. So they do those things. They build these systems that have all these different things because it takes time to do those things. And by taking some of those high intensity things off your plate, like insurance verification and submission and tracking and all that stuff, it frees you up to do customer service, marketing, focus on your sales process, focus on your teamwork, and build your culture. And those are the things that are going to protect the orthodontic office in the infinite game.
We don't want you to miss out on OrthoFi's biggest offer ever. If you schedule a live demo before March 31st, you could win free OrthoFi implementation and 2 free tablets. That's over a $9,000 value. Give them a call, start some more smiles. I know personally, if I didn't have OrthoFi, it would be far more difficult to do my job. I wish I had this when I was in car sales. Fortunately, I'm not in car sales anymore. I'm in orthodontics, and I love having this tool to be able to really treat our patients the way they deserve to be treated.
But we do have some time to answer questions. So, Katie, do you have any questions that have come in? Is anyone awake? Has anyone signed up that actually showed up for the webinar?
Yes, you guys are definitely really popular. And that was awesome. I think I can speak for everybody with saying we all learned something tonight. So thank you. We are going to catch these questions in the order they came in, guys. Just bear with us here. We got quite a few. The number one question we got actually is for you, Danielle. When you send a video message, how do you do it? What do you use? Are you sending it through text message? Is there a software you use? Tips and tricks for that.
Great, Katie, I appreciate that, definitely. So we're in the beginning stages of the best processes for these video messages. We realize they're effective. We also realize there's not a lot of platforms that allow us to use this type of video confirmation. With that said, we are using our phones to make these, to essentially record and then send. That's where I personally use my iPhone. Melissa, she likes to get things set up through iMovie, and she's got some pretty cool logo stuff that she puts on there too. But right now we're using our phones for this until we figure something else out.
Okay, perfect. And then do you only send that if you don't get a hold of the person, or do you always send it?
No, so I'm not sending it if I'm talking to them on the phone. My first line of defense, obviously, is to get somebody on the phone. If I don't get them on the phone, I don't leave them a message. I just hang right up and record my video message and shoot it out to them as a text.
If a patient calls in to schedule a new patient exam and they say they won't be getting insurance until January, but they call in, like, let's say November, should we still suggest that they come in January, or have them come in now when their insurance is a couple months out?
Well, come in now. You can still recommend treatment. You can still get the paperwork out of the way. You can still schedule something in January. You can let them know, do you know what your anticipated insurance benefit's going to be? I think it's going to be $1,500. Cool. This is what things are going to look like. So if you get that insurance benefit in January, this number less $1,500 will be your cost. But certainly don't turn them away, because they're going to go to somebody else who's going to get them in and understand how to keep them in their office. So definitely have them come in, recommend treatment, sign the paperwork, get it out of the way. Nobody bills insurance until an appliance is placed. So you can hold the paperwork, take up small down payment if you choose to, if they're willing to, with the understanding when they get their insurance in January, they'll give you the new information. We'll go through and update everything so that their service agreement reflects their insurance.
Any suggestions on getting the clinic motivated regarding same-day starts?
In another presentation we give, we have a graph that shows that, I think in today's everything happens at a flip of a switch seeming digital society. It's important to realize that a lot of the stuff is a process. It took us several years to get good at doing same-day starts right away, because you have a lot of scheduling things, you have a lot of operational things, you need to have stuff prepared so that you can just take somebody out of the clinic who wasn't really scheduled in there and then put braces on them that day. And that's sort of a longer conversation. But I think the best way to start is to have the information that is to build goals for your teams. And if one of the goals for your teams is to grow, one of the ways to grow is to raise your conversion percentage. And the way to raise your conversion percentage is to increase the amount of same-day starts. I think also your team should probably appreciate that things are moving to be easier, quicker, more convenient. That's just the way that businesses are moving, especially the successful ones. And so to stay ahead of the curve, focusing on quick, easy, and convenient in your business is probably a smart way to think about things in the infinite game, the next move on the chessboard. And same day starts, when you get it, a lot of people, when they think different, they think same day starts is automatically pushy because they think the reason we're doing it is because of us, which it does have a benefit for us. But if we're thinking about how to make things more convenient for the patient, think about the fact that they could come in for the exam, be diagnosed, treatment plan, understand their fee, make their down payment, and walk out of that office with a digital scan getting ready for clear aligners, or with braces on, not needing to come back to another appointment for a couple of months. It's really convenient. And for those of us that do a lot of same day starts, especially at the end of the day, they're really thankful that we made it so convenient for them, rather than feeling like they were pushed to do it.
Do you do same day starts for OBS patients when they come back in?
Sure, we do same day starts for everybody. If you're ready, we're ready.
If you're doing a good job of scheduling OBS patients, then most of them aren't ready, but we all have the one that is supposed to come in 8 months and they don't come back in for 3 years, and then they went from being an OBS to being ready. And so we will convert them into a possible same day start opportunity that day for sure. If you can, you want to have very few of those, because it's better to, again, be creating that value proactively and have them anticipating it if you can. But if you can't and they sort of pop in the schedule, then sure, you treat them as best you can in the short term, and offer them the convenience of the same day start.
We have a treatment coordinator. Her name is Rose. She's been part of our team for over 25 years. I've never seen anybody convert an OBS patient into a patient better than Rose can. And that's essentially, every time she goes into that, that's without a ton of preparation, because like Dr. Reynolds mentioned, she never had an opportunity to foam the runway.
A question about OrthoFi's collection protocol, and is it 30, 60, 90 days, or is it more robust? Which the answer is it is. But do you guys have anything to add about what OrthoFi is doing in the background?
Yeah, so it's way more robust than that. I think, as we mentioned before, it doesn't take much time to walk through the demo. There is an awful lot under the hood from a collections standpoint. What I will also say is that if you want your collections process to work at the highest levels, there are a few times when OrthoFi will ask you to step in, and it's as simple as saying, oh, hey, Mrs. Jones, I got a note from OrthoFi that they have a few questions about your account. Sometimes people will just ignore stuff and it gets behind, and OrthoFi doesn't see the person in person ever. And you just kind of remind them socially that to get back in touch, or offer to make that phone call to connect them. That helps, but there's tons of stuff that is underneath the hood, horsepower-wise, that they're doing for you from a collection standpoint.
This is from an OrthoFi customer. So you offer a 3% discount. Do you also offer the tiered discount based on the amount they put down, like OrthoFi recommends? That's part one.
The answer is yes.
We do 3% pay in full, 2% pay in 75%, and 1% pay in half. And so one thing I might also mention is that a lot of people have the amount that they offer for pay in full discount, but ask yourself if you've ever tested that. Most people haven't. I offer 10%, I offer 6%, I offer 5%, I offer 8%. So if you've ever compared what happens if you change that, most likely you could shave it down significantly. We used to offer 10%. We now offer 3%. Guess what happens to the remainder of that 7%? It goes to the bottom line on people, on the 20% of people that pay in full. So I would suggest that A, you offer tiered discounts, and B, you run some testing to see what happens when you lower it. And you can probably go quite a bit lower than you think you can.
The part two of that question was, notice on the slider you did not use the range of treatment like 18 to 24 months. It was 18 to 18 months in the example. Is that how you always do it, or is that just how you did it in the example?
That was the particular example. If it's 18 months, I will typically do an 18 to 22. Leave a little bit of flexibility for 0% financing through the 22 months. Sometimes $20 can make a pretty big difference. So when I present the slider, however, I'll always present it with the treatment plan being the 18 months, because essentially what we want is for the office to be paid in the amount of time that the patient is in treatment. But there's got to be a little bit of flexibility to it as well.
When the doctor comes into the room, how long is his average time in there?
We like to keep it as minimal as possible, unless there's some questions. And so it's, our doctors do a good job at, recognizing when they need to answer more questions and recognizing when they don't need to sit down and kind of go down that rabbit hole. So, there have been some times where the doc can come in and say, hey, how's it going? And it's just a couple of minutes, and there are deeper conversations to be had on occasion, but typically it's less than a couple of minutes.
And what I'll say is, since we changed the way our process works, it's significantly less. And so I'm willing to spend however much time I need to in there. But you have to do a couple things. One, you want your treatment coordinators presenting some of the information that that they can go through with the patient. And then two, have to pay attention to and learn to avoid asking questions that will generate responses that send me straight into the rabbit hole. So I like talking science, geeky stuff. And so I try to avoid asking those questions because it keeps me in the room longer. Now, we're in Detroit, and there's a lot of people for the automotive industry here that are engineers, and the engineers want to know all the details. And so what do you give to them? You give them all the details. You give people what it is that they need. What I used to do for years and years and years was give everyone all the engineer details, all the cellular molecular biology stuff that only a few people care about. And now I only give that to those people who really, go through the process of asking for it. And then, but my outcomes, what I'm doing in the clinic is exactly the same.
Do you ever email the new patient packet, or is it always snail mail?
We mail it. Sometimes if they call the day before, they don't get it in time, but we still feel that there's value there for them to see that in case they are going for a second opinion they don't tell us about, or if they do wind up impending, they have it. The better you are operationally about getting that stuff in, especially with the book, there are quite a few people who will read it and come in with underlines and sticky notes and stuff. And, I think their conversion percentage must be 99% when they go through it. It's really powerful for people who pay attention to it. And then we have a lot of them sitting around the office pretty much anywhere you can find it, and find excuses to give them away.
In order to start every patient same day, how do you build that into your everyday schedule?
Complicated-ish. So we made the decision that we don't schedule every appointment down to the minute. For example, we schedule clear aligner follow-up visits for 30 minutes. We schedule arch wire changes for 30 minutes. Those appointments probably take 10 and 15 minutes respectively, or maybe 20. But we build those in there because we don't schedule time for the same day starts. And then when we don't have them, then the clinic is kind of on cruise control. And then when we do have them, have one person run a couple of columns and have the time to do that, and then somebody else will take over for the start. There is a lot of that. Jeff Kozlowski and I do a day-long course that deals with a lot of that stuff. There's a lot more to it than that, but that's in a nutshell the way we do it.
Danielle, we've got a ton of requests for your scripting. Are you willing to share that?
Of course.
We are also doing a half-day course the day before the AAO on Thursday afternoon in Atlanta, provided that the virus doesn't shut down the AAO, but we'll probably be there talking to nobody. We'll be going into a lot more detail there, and a lot more of the nitty-gritty stuff that we didn't have time to share, and it'll be a lot more interactive where you can have on-demand questions and stuff like that.
What do TCs do when patients don't fill out their paperwork and they're waiting for insurance to be verified, et cetera?
Our front desk is really good about staying on top of that. They've got OrthoFi pulled up all the time. So when one of our one of our guests walk in the door, they're aware that this patient hasn't filled out forms. So there we have it. We're going to spend about 10 minutes filling out forms, and the front desk is going to help to gather all the information they need. They'll submit it to OrthoFi, and it's our hope that we'll have all the information that we need by the time that we're talking about the financial aspect of it all.
There's a question in here if you guys use Care Credit or a bank to finance.
We don't. And at least with the flexible financing, I'm not sure why it would be necessary. Many of the patients that would want that don't wind up qualifying. And then, as the algorithm for OrthoFi has gotten smarter, what happens when they do their credit score and you get the estimated treatment time and their down payment and monthly payment and everything, it sort of figures out that risk for you. This is another thing we didn't really have a chance to go into. So the algorithm's gotten super smart. And so it won't offer terms to people that are unlikely to pay for those terms. And so your default level is going to be low enough where the trade-off for outsourced financing to me doesn't make a lot of sense because the algorithm's gotten so smart. So we don't use it, no.
Where can people buy your book?
You can call the office and we'll send you one for free. You can, but you can find it on Amazon.
How do you handle no-shows?
As a treatment coordinator, it's the responsibility of a treatment coordinator to attempt to make contact with your no-show as soon as you realize they're not going to show up for the appointment. Your willingness to still see them is always great. Maybe they're running just a little bit behind, and then also the option to schedule again. So after your TC is called, they go into OrthoFi's pending follow-up. Typically, your TC will set the follow-up, and the intention for that follow-up is to get them to reschedule another exam.
How long is your average new patient exam?
45 minutes. That includes, the tour records, finding out concerns, to treatment planning with the doctor, presenting the financial aspect of it, getting the paperwork completed, and getting them into the clinic within about 45 minutes.
Thank you so much for everybody for joining us tonight. I know we got a ton of value out of that. The comments keep coming in about how awesome your talk was. Any last words before we all wrap up for the evening, guys?
No, I appreciate the time. I want to thank Danielle for once again making me look good. It's a great job.
Thanks so much for having us. This is a lot of fun to be able to share our processes with you. And then, when we get into this conversation with some of these folks at these different meetings, I get so much valuable information back. So this is just a give and take. And I just love the organization and everything that we're doing here. Thanks for having us, Katie.
Oh my gosh, thank you guys so much for hosting. It's been amazing. And thank you all so much for joining us and asking awesome questions. And we hope you'll join us for the masterclass and the next webinar we decide to do.